Hey everybody, good morning. It's Jillian. Just wanted to wish you a happy Friday. It's a good Friday for me. I've been up since 1, which is so funny because I'm just so full of energy right now. I'm getting a lot done, like a lot done. And so I wanted to focus on what dehydration is versus hydration, and then hyponatremia versus hypernatremia. See, there's a lot of articles out there that don't understand Jilly Juice that want to leave out the other scientific terms when it comes to how salt and electrolytes affect the body. And so I'm looking at when you are dehydrated, okay, means that you're not taking in enough water. I mean, that's pretty much what it means. Is when someone's dehydrated, it means, first of all, they got sick, because a very well person wouldn't be dehydrated. Well people will drink water when their body tells them. Okay, so if you get to a point of dehydration, it's because you are sick and you are not taking care of your body. And so when does dehydration happen? It happens when people get exposed to a pathogen or a flu bug, and then they're stuck at home doing a bunch of diarrhea. Okay, so flu and pathogens and bacteria that are pathogenic. Not all bacteria are pathogenic, but there are specific bacteria that are pathogenic to the body that will cause the flu bug, to where you're vomiting, you're throwing up. So it all is relative. Where dehydration is relative to what triggered it to begin with. Okay? So anyway, so when you're dehydrated, what do you do when you are so dehydrated and you have to go to the ER? Well, what do they do? What do they do to you? Oh, they give you an IV bag, a saline solution. Okay? So dehydration comes from the fact that the reason why they're giving you all of the saline solution of salt, water, and sugar is because when you have been throwing up and when you have been diarrheaing, you're not taking in enough nutrients and electrolytes and all of that. Your body's reacting to a pathogen, and guess what it does? It pulls all the water, or a lot of the water, out of your system, a lot of it, okay? It takes the reserves. It takes the water, it takes the minerals and other types of, nutrients to go and push out that pathogen, okay? So bacteria is bad bacteria. Pathogenic bacteria is bad. That's why you get vaccines, so that way people don't die from the flu. Okay? So that is what causes dehydration. Now, when you're hydrated, it means you have a well balance of electrolytes. It means that you have well balance of water in your system, because there's so much. There's such thing as too much water. You've heard people taking so much water and flood their system to basically dilute all of the electrolytes out of their system. And that's essentially like drowning. That's how a person can die, is when they have too much of water not balancing correctly the electrolytes, the minerals that are in your body. Okay, so remember, again, this is about balance. Remember, about balance. Then you have hyponatremia versus hypernatremia. Now, I've seen articles out there that only want to talk about, I think it's the hyper, where there's too much salt in the system. Okay? So, hypernatremia. Now, let's go just take a look at what that is. Hyper is a common electrolyte problem that is defined as a rise in serum sodium concentration to a value exceeding 145 mmol. It is strictly defined as hypersmolar condition caused by decrease in total body water relative to electrolyte content. So guess what the cure is, or guess what the cure is for hypernatremia? Okay, just take a wild guess, you guys. Take a wild guess. What would then balance out the salts and the electrolytes in the body? Oh, guess what? It's water. So when you have too much salt in your body, for whatever reason, whether it's eating popcorn, or drinking a really salty drink, whatever it is, okay, guess what the balancing force is? It's water. So when somebody is just shoving straight salt down somebody's throat, first of all, you know, if you're just shoving salt down somebody's throat, that's unnatural. Humans don't just take spoonfuls of salt. Now, they take spoonfuls of sugar, but they don't just take spoonfuls of salt and just eat it. Okay, that's not even based in reality. I don't think anybody has taken spoonfuls of salt and just eat it to the point to where they will then induce hypernatremia. Okay, but there are people out there with articles that say that this is what Jilly Juice is doing. She is advocating people take basically spoonfuls of salt, like taking like 10 tablespoons of salt to like maybe this much of water, and saying, hey, everybody, drink something like this, like salt water. That's all people are saying. And I'm like, no, that's not true. But let's look at what hypernatremia is, or hyponatremia, I'm sorry. So hypernatremia is when you have too much salt in the body, not enough water. Hyponatremia is a decrease in serum sodium concentration. So it's less than what your body needs, okay? Which means you have an imbalance caused by an excess of water relative to solute. Common causes include diuretic use, diarrhea, heart failure, liver disease, renal disease, and syndrome of an inappropriate ADH secretions. So when you have hyponatremia, it means you don't have enough salt in your body. That's a low sodium diet that a lot of people out there with cancer, disease, and chronic illness are triggering. They have a very low sodium diet and it's triggering hyponatremia. Okay? So, how the heck do you balance out between hypernatremia and hyponatremia? Because what would make a person go to both ends of the extreme? What would make a person have too little salt? What would make a person have so much salt? Well, if you have too much salt, it's because you're not balancing out with water. Why aren't you drinking water? Isn't the natural reaction of the body is when it's exposed to a very salty substance, whatever it is, that you drink water when your body tells you? It's like you don't intellectualize drinking water every day. You just do it because the body tells you. Believe me, if I had to worry about when I drink water to survive, that's too much to think about. I got too many other things to think about. But, you know, my life is too busy to worry about how much water I should drink per day. So guess what? When my body has a natural inclination to water, it's like saying, hey, I'm thirsty. Guess what I do? I go and drink some water. Okay? So, so it means that when someone, you know, no one would ever take spoonfuls of salt. There are psychotic people out there, like mothers, for whatever reason, that did this one case where she was feeding her child just straight salt in the baby's mouth and the kid died. Now, I have people trying to liken me to that, which is a gross misrepresentation of the Jilly Juice protocol, for one, and number two, it's complete flat out bald-faced lie. But hey, anything for hits and clicks, right? So I just wanted to make sure that I am actually teaching some people who are not in the know some of the science that's out there that is really at their disposal, but they choose not to focus on it. Okay? So, all right. So anyways, so then, so hyponatremia, hyper So then how would you get to have too much salt? Or not too much, too much water? Well, when you have these crazy ass diets people are on out there that are drinking gallons and gallons and gallons of water, but they're not taking in enough salt because they're listening to all these different gurus out there that are saying, oh yeah, everybody is, dehydrated out there, and you should drink like 8 glasses of water a day or 10 glasses of water a day. I mean, there are people out there that are saying that. And so when people take so much water, guess what? But not enough salt. Really, it's not even that. It's not even taking so much water. Yeah, you take so much water, but you're not going to really force yourself to drink water. So what is it? So when you have a low sodium diet, guess what? You're going to trigger hyponatremia. Because you're not taking enough salt, not enough electrolytes, then it causes an imbalance. So how does a body stay balanced with J juice? How does it? Well, the thing with J juice is it's not just salt and water. That's basically all the saltwater flushes that are out there. And that's all the holistic alternative therapies that some people think that this is what is, and it's not. This is actually a lacto-fermented cabbage and kale using pink Himalayan salt. So what's the difference? Well, there's a few other ingredients that are added to it that you wouldn't see in a salt flush. You have lactobacillus, which is cancer's mortal enemy. Candida's mortal enemy. Okay, Candida is cancer, though some people would totally disagree based upon the context of their research. And then we have nutrients from the cabbage and kale that are broken down through the chemical process of fermentation. And those nutrients actually feed your hormones. So when you drink something that has water and electrolytes and lactobacillus, because water is the carrier force, it's part of the Jilly Juice protocol. When you drink something with water, it carries in all of the nutrients, which means that when you have a juice that has been fermented with pink salt, and pink salt has minerals, okay? It has the salt, it has minerals. It also destroys pathogens, and it decalcifies heavy metals. It decalcifies minerals to where, and that's where heavy metals are, like highly, you've seen decalcification solutions with salt as the main ingredient. I'm sure you can go and Google that. But salt kills pathogens too. So, when you go into like the Dead Sea, or when you go into the ocean and you have dermatitis, you have, oh my God, I saw last night somebody's picture of her leg. She has like phlebitis. I think that's, or blephitis, blephitis. I mean, it's an extreme skin condition to where her skin is peeling and pus is coming out and it's totally red. And the only thing I suggest to her, because I didn't even want to bring up Jilly Juice, is that she needs to go take a saltwater bath. Go get some pink salt, put it in your bathtub, and go soak in it. Yeah, it's gonna hurt like crazy because salt, say like, rub salt into wounds. Yeah, when you're in pain, that's the prostaglandin hormone being released. That's been basically inhibited for many, many years. So, but yeah, I mean, salt has been known to have many salt water has been known to have many healing properties. And ask anybody over there in the Dead Sea and any real health professional, they will tell you the benefits of salt. And they will tell you it's a balance of, and guess what? What's the balancing force of salt? It's water. What's the balancing force of gases when you have too many pathogenic gases? Let's say methane gas. What's the balancing force? It's air. So water and air are balancing forces. Those are the main things that comprise our earth, is air and water. Okay, and then you have all the different minerals and elements and everything based upon the context, all mixed in, working with each other. And sometimes, yes, we have industry and we have things that kick up certain types of negative elements, and they kind of coagulate and they accumulate. And so then what is the balancing force? It's air or water relative to the consistency of it. I mean, this is some basic shit here, okay? I feel like it's so crazy that I am actually teaching indirectly people who have degrees from universities. It's almost embarrassing that I have to actually go to basic science about balancing forces, because salt, when salt is just there, salt is used to energize so many other elements. I mean, you have sodium fluoride, sodium this, sodium that. You see sodium is attached to all these different crazy ass strong aggressive elements. Well, what's the reasoning behind that? Because salt is the energizing force. So now to figure out, what are you energizing? Are you energizing a pathogen or a heavy metal, like an extreme accumulation of heavy metals? Are you energizing that? Or are you energizing a chemistry of elements that are part of the elemental composition of the human body? See, this is where people need to do their research, is they look up the elemental composition of the human body and realize the first 9 elements have electrolytes. It has actually air and water, okay? Air, oxygen being the most prevalent in the body. Cells have to breathe, and water being the next. And then you have all your electrolytes and all the different then trace minerals, okay? So you don't only have just electrolytes in the body, you also have heavy metals in the body too. But guess what makes sure it keeps the balance? It's called the laws of your immune system. That's the difference. Your laws of your immune system, based upon how well you take care of the laws. Are you violating the laws, or are you adhering to the laws? So how well your immune system, which basically covers everything with your body, cell regeneration to degradation, that, you know, oh my God, I'm just tripping on the fact that I have to teach this stuff that is not known to people out there. But yeah, I mean, your body has laws. Your immune system has laws. And so if you adhere to the laws of both your immune system, as well as all the different contexts within the different systems in your body, the body will then go, you know, when you drink the juice, the nutrients and all that will disperse and activate the immune system, as well as trigger cell regeneration, because that's just what, I mean, we're not supposed to die. The reason why we do, right, Kevin, the reason why we do die is because we don't understand the right concoction of the formula of life. Now we do. And the reason why people don't believe that we should be living indefinitely is because they've been allowed to believe that they're supposed to die. But we have an immune system that's supposed to trigger autophagy. We don't trigger autophagy at the level that, at the same level that we don't trigger autophagy the same way we don't trigger rapid healing. Okay? Autophagy is when you release when you release the calcineurin hormone to then purge out mutated cells. And this is why we have all the cancer, disease, and chronic illness and handicaps and autism, is because you're allowed to have the cells stay mutated. Yeah, we're walking mutations. And I know this is so like inflammatory to people who have children that are autistic or have children that are disabled. And I'm so sorry that the truth hurts, but yeah, that's what genetic predisposition is. It's mutations being passed from mother to child. Okay? And so when we are not triggering the calcineurin hormone to then purge out, disassemble, or purge out the mutated cells, guess what? The body adapts to the mutations and figures out, they do workarounds. They create a workaround, and those workarounds are then the handicaps. That's really what mutations are. It's that the body, or adaptation is, and the body's mutated, and then it adapts to the lifestyle of the person that keeps those mutations in place. There are now workarounds in the body. What's a workaround? Well, you apply it to the tech world. Okay, when there's an issue in an overall business process, and they can't afford to go and overhaul the whole process, but they can go in and do little temporary fixes, or find, just a little, temporary fix. And maybe not even a permanent fix, but doesn't fix the whole system, but just that little area. It's called a workaround. Sometimes it's more cost effective to just do a workaround than to completely take the system apart and figure out where the problem is. But that's what it is. When we sustain autism, when we sustain so many different cancer, disease, and chronic illness, we are sustaining the workarounds until the body says, hey, I give up. I have no more power anymore. You've basically given up on me. So I'll do the best I can to give you the workaround, but eventually, you're not giving me what I need. So you're going to have to be held accountable for the lack of knowledge. Okay? So yeah, so with this juice is, you'll be doing waterfalls. Those people want to say it's explosive diarrhea. Well, you can call it whatever you want. Explosive diarrhea sounds kind of yucky, so I'm not going to really refer my juice and what you're doing as explosive diarrhea, but I'll tell you why the manifestation happens. It's all about what triggered the event to begin with. Okay? When you get exposed to a pathogen like food poisoning, because let me tell you, salt isn't poisonous, just so you know. I mean, it's poisonous if it's just salt, but we're not doing just salt. We're doing salt, water, electrolytes, and lactobacillus, and all the nutrients. But if you're exposed to an actual pathogen, I'm going to say poison, but a pathogen, let's say a really aggressive flu bug, and you have diarrhea or throwing up, like I said, the body goes and pushes it out. Okay? And so it takes the water from the body and pushes it out. And that's how it protects itself. And then when you're not giving your body any more electrolytes, okay, guess what happens? People get dehydrated and they go to the hospital. Well, with Jilly Juice, you're actually not taking in any pathogens. Okay? You're not taking any pathogens. You're taking in an actual live probiotic. It's been tested 13 million colony-forming units. And how can 13 million testimonies be wrong? If 13 million colony-forming units, live active cultures, are surviving in 1 tablespoon of salt, of pink salt, to 2 cups of water, then it's not going to hurt a person. That's why the OAG wanted me to substantiate the probiotics. Is this a probiotic? Prove it. Okay. I paid $100, got it tested, came back. Here's a report. Nothing else said. Just change your advertising, but you're fine. They didn't say it was fine, but they didn't respond to anything more than just change your advertising. That was it. Now, if it was antibiotic, if my juice was antibiotic, they would have said cease and desist from promoting anything, even on Facebook. Look what happened to Dr. Sebi. Look what happened to all these different health coaches, nutritionists that are pushing the antibiotics. The law came down on them, not just for advertising, but they went to jail because they were dealing with antibiotics. There is a difference. You read some of these articles, these blog sites that say, oh, yeah, there's no such thing as probiotic and antibiotic. If it's not an antibiotic, then it must be probiotic. That's not true. Yeah, if something is not a probiotic, then it's antibiotic, because those two things are complete opposite of each other, and it's in the context of each other. Okay, one is pro-life and one is antibody, anti-life. Pro-life, anti-life. I mean, just look at the root words. Let's pick apart the dictionary for a minute. No, but you get the gist. So how can 13 million colony-forming units be wrong? So when you are taking in this juice, it's activating your system. It is giving you the nutrients. The water is the carrier force. Okay. And so this is when you're drinking the J juice. The water is the carrier force, and the salt energizes the nutrients. And then what happens is that you have pathogens in your body that the body is trying to purge out. Okay. Since we are walking mutants, we are harboring parasites, we are harboring excess heavy metals that are in the candida. We have an imbalance of 3 different things: antibodies, candida or yeast, and then hormones. Okay? Those are the 3 things that will either hurt you or keep you alive if you keep it balanced or imbalanced. So the J juice, when you're drinking it, you are actually, the lactobacillus keeps the candida at bay, kills the candida. Okay, the excess yeast. You need yeast. The water is the carrier force. The nutrients is what keeps your hormones well balanced, because nutrients, vitamin A, B, C, D, it's all about hormones. And then the antibodies are being then dispersed, because agglutination, when someone dies from antibody agglutination, is because so many poisons are in the body, it shuts the body down. That's why you don't mix A, B, and O blood together, because O negative people would die from an AB positive blood type. Surface marker antigen would then cause antibody accumulation at a rapid level. And that's why people die, is from an overabundance of antibodies. So the salt and the water and the lactobacillus and the nutrients also break up the agglutination in the antibodies. And then you have the prostaglandin hormone being released, because that is the sensation of pain, and it's been inhibited by antibiotics and anti-inflammatories. And so that's why people then feel pain. And that's what happened to poor Bruce Wilmot, is that he didn't understand that. And I told him pain is healing. He didn't understand that. That's okay. So he probably got off the protocol a long time ago. I mean, I don't mean to laugh, but it's just like, this is what we have to understand. Pain is healing. I can't get any more clear than that. The more that you mitigate the pain by using negative elements such as antibiotics, the more you are taking and degrading your body down to a level that you don't want to be at. Okay? Because symptoms are basically the body telling you it's trying to heal. When you are asymptomatic, when you're asymptomatic, it means either you have an overabundant or overaggressive immune system, or you're dead. Okay? But having symptoms would then say that, yeah, you're alive and you're feeling these things. But there are people that have a mutation in their hormones, to where, one person I know of, to where they don't feel pain. It means that their prostaglandin hormone was permanently turned off. Like, she doesn't need to take any antibiotics or anti-inflammatories or painkillers, because this woman, who is also aging, doesn't feel any pain at all. So I don't know how the hell she can figure out what is going on with her to fix the problem. But the only thing that she would know is just by if she sees sores come up or something. Because how would you know? The only thing you know is either how you're pooping or pee, how your eyes, and whatever that you can see. Because if you can't feel pain, then how do you know what something is broken to go and fix it? Not hide it, but fix it. So I really feel bad for the day when they figure out what mutation she has that turned off her prostaglandin hormone indefinitely. Oh, that day, I feel bad for anyone that gets matched up with that. So if 13 million colony-forming units can survive in my drink, then it means that my drink is not poisonous at all. Salt, water, and lactofermentation. Salt is not inherently poisonous. It's no different than overdoing it with water, creating an imbalance. Nobody goes and just takes straight up salt on a spoon and just eats it. No one just eats salt. They take salt and put it on their dishes to then enhance the flavor, like monosodium glutamate, a flavoring. Just like Kevin said, baking soda, sodium molecules attached. Sodium bicarbonate, carbonation actually is an anti-inflammatory. It ruins the gut health. It kills good beneficial bacteria. So you figure with 13 million colony-forming units of beneficial bacteria, probiotic, imagine the kind of healing a person would get. Imagine how many children out there would reverse their autism if they understood this. Imagine. That's hard to imagine for a lot of people who are very stuck and stayed in their current belief system. But that's okay. They have every right to do that. I just feel bad for the kid. I just feel bad for the kid that has no chance to reverse their condition because the parents did not think that their condition could be reversed through strategic nutrition. But hey, we can't legislate morals. We can't tell parents really what to do as long as they're following with the guidelines of the medical system and the law. It is what it is. Okay? So, but that's their right. That's their belief. That's okay. Doesn't mean that, like, I'm going to follow that if I have a child. My child wouldn't be having any issues anyways. I probably wouldn't have a kid because I'll be the best copy of myself that I wouldn't need to procreate. At least that's my theory. But then it's all rooted in how nature works. Procreation, reproduction come to make, is triggered to make sure that the species does not go extinct. Okay? So when you have dehydration or too much water or hyponatremia and hypernatremia, it creates stress in the body and releases hormones, and it's telling you, to go and take care of it because it doesn't want to die. It doesn't want to risk extinction. And then people hold on to mutations for years, and when they finally address it, they got to feel pain. They think that the nutrition is hurting them, but no, you got to look at context yet again. This isn't just salt. This is a combination of electrolytes plus lactobacillus and the right nutrition. So the body would never look at it as poison. So now you have to look at what are your symptoms and why do they happen? Well, yeah, you have antibodies that have been agglutinating that are finally being released from the body. When you take a drug test, how do they know if you smoked pot recently? Oh, they look at the antibody count. They count and say, oh, okay, she took some pot not too long ago. She tested positive. When you test positive on any type of titer test or a drug test, same thing, antibodies are antibodies. It means that you have a certain amount of antibodies that are either altering your state or giving you a level of protection. One of the two. But it's not even the fact that they're different. It's just what's level of protection. It means that next time you get exposed to a pathogen out there, the body's going to go into action and protect you from any more mutations type of thing. You sustain that mutation, no one ever fixes it. Now you have the antibodies, but they don't ever get controlled. They just keep, they just keep agglutinating. But you'll be asymptomatic for however long until the body finally degrades. And I can't tell you. I guess, yeah, I could tell you. When you see autoimmunity, when your immune system creates antibodies automatically. And there you go. You have those conditions. And then as far as an altered state, well, yeah, when you have too many antibodies, you have an altered state. Yeah, being sick and having a chronic condition is an altered state. I guess driving crazy because you just took a bunch of pot or meth or something. Yeah, that's an altered state. That's a type of sickness. Okay. Oh, this thing is so tight on my head. I've been up since 1 this morning doing a bunch of stuff. So So that's why I'm awake and sort of coherent. But yeah, I mean, salt, the nutrients, the diseases. So yeah, I mean, you wouldn't die from J juice. Nobody dies from J juice. People die from ignorance. So it's excuse me. It's interesting to read all these different articles that are out there. And you know, I've been very political, and we all have been very political. Yeah, I know. Yeah, it's a Bluetooth with soft cushions. Yeah. Well, I think it's just the tightness of this because it's just hugs. It hugs. But, you know, people's politics should never, ever be on trial. So, you know, politics are hard. That's why I'm now staying away from politics. But it's hard not to mention something, especially in the health and wellness world, without somebody misinterpreting what you're saying, because there really isn't many words to describe something that we all know. I mean, that's why I made up procreation category. I mean, I could say sexual orientation, but that still sounds very inflammatory to some people who are very sensitive to the politics around that. So that's why I make up words to fit a different context, so that way we're not politicizing what goes on with the body. You know, and there's nothing wrong with being mutated, because people are mutated in so many different degrees. You know, you can have a very superficial mutation to a very, very deep, aggressive mutation. And death is a mutation. Okay, that's the ultimate mutation, is death. And then there are all the varying levels of mutations that people deal with. And some people can live with their mutations and thrive for a certain amount of time until the body says, hey, I give up. I can't do this workaround anymore. So, you know, how would you figure out how to fix your mutations? Well, you have to understand that the body does adapt to poisons, or does adapt to the mutations and deals with it, does workarounds, but it needs the proper nutrition. It needs the right balancing forces. Okay? So it is very possible to fix mutations with the right formula. And you're not going to find that in your doctor's office. If you're looking for something or somebody to corroborate in the academia or in the doctor's office, biotech, that there is a way to fix your mutations regardless of what they are, you're not going to find it, because they don't deal with that. They deal with the shortcuts. They deal with the temporary fixes to mitigate pain, because that is what it is people are asking for. Nobody's asking to live forever, so they're not going to try to find out. And then when you do say, okay, I want to live forever, well, you got to deal with the pain. Here's some nutrition. Okay? I really got to take this off.